Evelyn,
Did it.
yes, you made it.
Yeah.
Okay, take a deep breath
Okay.
and tell me, how was your day?
It was good, but I have to pay. I am traveling to La Paz next week,
Mhm.
so I need to buy my ticket, and I have it. That's why I was late.
Okay, so people are asking you to take the PCR or not?
Ah, no, 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 no.
Oh, that's good.
Yes, no, I wouldn't travel. I'm
Okay.
scared of that.
Yeah, I think people still thinking about that and asking that thing, but that's so good. I will go to Cochabamba then.
Yes, you should. When you travel to another country, yes, they ask you for the PCR, sorry.
Yeah, yeah, because a few weeks ago, I think, well, almost a month, my friend was asking to have the PCR to travel. That's why I was asking you.
No, 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 it's not necessary. Just go with your mask and everything is okay.
Okay, so that's we
Okay,
have
okay.
to take the time. Okay, so did you remember the lesson of last week? What we
What?
were talking about?
What means sorry?
Do you remember the subject we were talking about last week?
Yes, about signs and symptoms.
Right, that's right. Okay, so I will ask you some things and I will put you in some situations in order to describe for me how did you manage that kind of stuff, okay? For
Okay.
example, can you list the causes of anemia and maybe another illness that you usually manage on your consultation?
Okay. The causes of anemia are really long because we have the microcytic normochromical anemia, microcytic, how can I say it in English? It's like, I don't know, it's like, all right,
Right.
macrocytic normochromic or something like that. And the normocytic normochromic and the microcytic mycochromic. Yes, that.
Okay.
This is something like that. In Spanish, it's more easy. But
Yeah, that's right.
okay, then it depends. Like it can be like deficiency of iron. It can be thalassemias. It can be a disease, a chronic disease. It can be mm, a chronic, a renal chronic illness. We can say it
Yeah.
like yes.
Yeah, that's so good. Yeah.
Okay. Or just like you can absorb the vitamin B12
Mhm.
or the folic acid. I don't know if that's correct too. Acid or
Yeah.
folic
Just thalassemia in case
thalassemia.
of, yeah.
Okay, thalassemia. And that
Okay. Um, that's so good in case of anemia. Then I don't know if you can describe another illness that you manage on your consultation normally. Maybe diabetes
yeah,
or
diabetes.
hypertension, you know.
Well. The things that is the most common is hypertension, diabetes, and hypothyroidism.
Yeah.
I, and well, you want me to describe the causes of diabetes, okay?
Okay, that's it.
Okay. The causes can be separated in diabetes type 1 and diabetes type 2. On the diabetes type 1, it can be a genetic thing. So you can born like this disease because it's a disease. It's not a sickness and it's not illness.
Yeah, that's good.
And you have to put on the insulin every day because these persons are like that have a resistance of insulin and they have to, well, they don't produce insulin, so that's the thing. That's the thing. Then we have diabetes type 2, that they're the most common of type of diabetes. So we can see the perfect patient sometimes, and all the people think that are people that are fat, and then people that are, I don't know, that eat really bad and those things. Yes, they can. I don't know how to say desencadenar.
They can be factors
Okay.
to, or due to those factors, people has diabetes.
Yeah, they can be factors that increase the risk of this illness. So, but actually, the patient with diabetes type 2 are really skinny because they have the waste of how can I say it? The
What do you
pérdida de peso is loss of weight.
loss of weight?
Loss of weight. Okay, I was confusing the words. Loss of weight, and they are really thirsty. They want to eat a lot, but their people are skinny on the terminal phase. Actually, when they don't treat, they really they're really skinny. It's really
Wow.
yes.
Yeah, I was about to ask you how does these people look like usually, but if you're telling me that in the last maybe last episodes of their illness, they look like skinny people, right? But
Yes.
they are fat at first, or not? Not
Well,
necessarily.
not necessary, but that's the thing that all the people thinks. He has diabetes because he's fat, or you can have
Yeah.
diabetes because you're fat. No, it's like you can be a little bit fatty, but it's not necessary that
Toby.
you. Yeah, so weak, but no, that's the thing. I saw patients with diabetes and they're really skinny. Actually, you will think that they are anorexic, but no, they're just skinny because of
Oh,
that. Yeah, the disease. Sorry.
I didn't know about that. So that's so good. So I think all of us, we have to go and make some tests then, right?
Right, right. But it's a thing that in diabetes also you can get fat because if you have the insulin resistant, it's like all the things that you eat, you're gonna make you fat because it's not the insulin is not having the synapses with the glucose, and they're not absorbing. So you're going to get fat, and that happens a lot with the girls that have a polycystic ovaries.
Uh-huh.
And that's really common. They think that they're getting fat of something that they're eating, but no, it's just
Or because hormones, right?
the hormones and this is that the insulin that is really important, that is not getting a good way to absorb in our bodies.
Okay, so that's very important to know. Then I will take into consider into conscious. Okay, I want to ask you, or I want to put you in some situation. Okay, the last thing, you have diagnosed a stress fracture of tibia in a young female dancer. Okay, how would you explain to her the cause and the management of her condition.
Okay. You're gonna be the dancer.
Okay.
So, okay, you have to cry a lot because that's
Okay. I will act.
Hi, Misheel. I'm Dr. Beleni Pore. And well, I think that the fracture you have, you were really lucky because some dancers are that I saw, they were really bad. But I think that you are better, and we can make a really good surgery on you. That maybe you can dance, but you have to see to the probabilities that that you can ever dance again because we're gonna put a how can I say placa plate plate.
Barrel or a shift?
Okay, a shift that is gonna hold your bone and it's gonna help to cure better. That's how it said. Cicatrize.
Let me check.
Okay, I'm gonna check it too. It's really hard to say that because actually the dancers that fractures doesn't recovery, right?
Yeah. And in that case, how can I go to some place? I don't know if I want to go somewhere or I have to stay at home. I have to be quiet and calm. What I have to do?
Yes, you have to restore yourself. So you have to be in bed for a really long time. So you're gonna have the chance to your bone to recovery faster. You can. It's better if you don't walk when you recover it, and always. And after it consolidate. How can I say consolidar? It consol.
Okay.
Okay, and then you're gonna go to the
Consolidate.
okay. After it consolidates, you have to go to the physiotherapist to start moving again your muscles and recover a little bit of strength that you're gonna lose in the surgery, and because you're gonna be in bed. But you're gonna be very great after that.
Okay. Thank you very much, Belen. You can try to use some words. You know that maybe an scar will be almost a synonym of cicatrization, right? But you don't know how to use it. Then you can say you have to wait for your leg to heal, okay? Or the time for healing. You have to wait the time for healing. Try to find some words that you can use to explain your patient. Remember, your patient don't use usually those terms that we use constantly, right? So it's not so much trouble now, but we have to find another words to say it. In that case, um, can I ask you for some homework?
Sure.
Can you find synonyms for this term?
Okay.
How to say cicatrization or healing or that kind of stuff, okay? And we can share with your classmates tomorrow.
Okay, fine. Cicatrization.
Yeah, or healing.
Healing.
Okay.
Okay.
And I will ask for you to fill this questionnaire, please.
Okay, Miss.
And we can still speak in. Thank you. Because we have little more time and your classmate won't come in, so we can still speaking if you have time. Okay.
Sure.
Okay. So I was searching some things on TikTok, and I I saw your
Oh my God.
one of your videos, the last one, and that's
Okay.
so good. I casually saw that, but that's so
Um,
good.
I'm so red. I'm sorry.
No, why? You're young. It's a good platform to start make conscious people about this problem. You know, try to tell them that they have to use mask or to wear mask, or that doctors are here to help and people must help them just staying at home or something. It's so good. I think it's a good way to make conscious about these topics.
Yeah, I was really
Actually, I have
mad.
one video almost like that.
Really? You have TikTok too? I'm gonna follow you.
I
How
will
did?
I erased my my account.
No, why?
No, I'm just kidding. I will I don't know how am I there, but I will give you, I will pass to you just to make fun of us and just to make conscious of people, okay?
No, yes, it's fine.
But that's so good.
Actually, I was really mad when I made that video
Mhm.
because I saw so many stories of my friends on Instagram that they're going to parties all day. And I'm like, they went to their homes and kissed their parents, and they were like with 50 persons without the mask. And I was like, no, that's not good. And here I am that I moved because of my, I don't want to, I don't know, contagiar.
Um, be contagious.
Okay, be contagious to my family. So my family stay in my home and I came here to this apartment for them. So I can reduce the risk of that. And then I saw all my friends doing that things. It's not good. So
Yeah, but
that's
I think you or spread the virus. You don't want to spread the virus, okay? It's
okay.
another synonym of contagious. But you cannot use con, contage, right? So
Yeah.
we will use spread, okay?
Mhm.
I was telling you that it's a good thing what you say, what you did. So I think I will wait for more videos like that. Okay.
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 Follow
Thank you,
me.
Belen.
Okay. Bye, Michelle. Hi,
Thank you.
Ali.
Bye. Take care. Hi, Alec.
Bye.
Good afternoon. Bye bye. Hi, Ale. How are you?
Hi, teacher. I'm fine. How are you?
Fine, thank you. How is the weather on Cochabamba?
It's sunny today. Sorry, teacher. I'm late. I had a little problem with my computer.
Don't worry. We have I don't know 10 minutes left or 12 maybe. We are gonna talk about our topics, okay?
Okay.
Okay, so do you remember what we talked about last week, right? Do you remember the subjects? Do you have any questions about that, or it's everything clear?
Mm, Yes, I was reading some of the vocabulary,
Mhm.
uh, but I have some questions about the time is in the past. That's true.
About the time?
Yes.
Okay, tell me if I can help. I will do it.
Mm, can I explain in Spanish?
Yeah.
Sí, es que en una parte dice, por decirlo en presente simple, y en otra parte dice eh, have, por ejemplo, I have been feeling, ¿cómo sería? Of color, creo que dice algo así. Y en
I,
otra parte
I have
dice,
been feeling sick, for example.
yes, y en otra parte dice
I felt.
I felt, yes. Entonces, ¿en qué momentos podría usar cada uno?
Okay, it's just to understand that your patients will use that kind of explanations to tell you that they are not good. Okay, they are just examples. So if you ask, for example, how have you been feeling today? Do you understand that you're asking for today, right? And your patients will tell you, I felt sick this morning, talking about this morning, or I've been feeling bad the whole day, you know? It's just like a game, almost a game. It's not specifically for some situation. Your patients will guide you, okay, while you're asking. Maybe you will ask, how have you been feeling yesterday? Or how have you felt yesterday? And your patient will say, I felt bad, or I felt sick, or I felt nauseous, right? Because she is or he is talking about yesterday. But it depends on the question you will ask. Is it understood?
Yes.
Okay, so don't worry about the times more specifically. It will depend on the question you will make. Continue.
Yes, it was the biggest problem I had.
Okay, yes, I know it's a little bit confusing at first, but then you will find that some examples that we have in the book are more easy than they appear, okay? So don't worry, and it's okay, you can ask. I will explain you anytime, okay?
Okay.
Okay, getting to our subject. I want you to make a list or a list of causes of anemia or another illness or disease that you usually see on your consultation.
Causes of anemia.
Yeah.
It would be for deficit of iron, maybe. Loss of blood, maybe. Low production,
Low production.
And excessive destruction of blood cells. It could be.
Okay. Okay, that's so good. And I want you to choose another disease or illness that you usually see on your consultation. And maybe tell me causes of that illness or disease.
It could be, I don't know, like some respiratory illness.
Yeah, could be.
Well, the patient have or has that cause a virus or bacteria. It could be. There are the most typical causes.
Okay. That's so good. Now I will put you in a situation, okay? And I want you to think about this story. You have diagnosed a stress fracture of a tibia in a young female dancer. How would you explain to her the cause and the management of this condition?
Well, I could say to the patient, I have to deduce the fracture first. And next, I have to
Fracture.
put how I could say yeso.
Remember we were talking about yesterday?
Plaster
Cast. What? What, sorry?
Plaster cast, I sweet.
Yeah, that's good. Plaster cast. Okay.
And that is in the Zoom.
Okay, that's so good, Ale. That was good. I will send to you my little questionnaire, please. Hi, Vania, how are you? We will start in a second, please.
Hello, Miss.
Hello, Vania, how are
Hello,
you?
Miss. I'm fine, Miss.
So good. Okay, just a second. Thank you very much,
Yes,
Ale.
yes.
See you tomorrow then. Okay?
Thank you, teacher. See you tomorrow.
Okay, take
Bye.
care. Bye-bye. Okay, Vania. That's so good to have you here. How was your day? How was your work?
Today was a day very busy. In this moment, I am working still, and yes,
Okay, you just take a break to talk with me.
yes, yes.
Okay, I hope they cannot bother you while we're talking, but we will make it fast, okay?
Okay, Miss.
I wanna ask you something and I will put you in some situations, okay? For example, I want you to list the causes of anemia first of all, and then another illness or disease you usually have in your consultation at work.
Okay. The most common cause about anemia is ferropenic anemia in patients of um, who doesn't have a good apport of iron in 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 his or in their diet. And the second place is patients with hemorrhage, or you say sangrado hemorrhage, acute
Yeah, that's good. Hemorrhage.
hemorrhage, yes. Um,
Or hemorrhage. It's okay. What you
hemorrhage, it's okay.
yeah.
Okay, and frequently consultation is hemorrhage digestive or digestive hemorrhage,
Digestive hemorrhage.
digestive hemorrhage in patients enolics or with hepatic problems, no, liver problems.
It's okay if you say hepatic, okay? Or liver problems or problems in the liver. It's okay, but hepatic, it's so good.
Okay. Hepatic problem, yes. Uh,
Perfect. And I don't know if you have another illness or disease you want to share with me. Some causes of this. Choose one.
One, about COVID, maybe.
Yeah, that's good.
Okay. In the place where I work, I am I am consulting a lot of patients with
I'm
COVID
attending.
and attending a lot of patients with COVID. The symptoms are variably, but how you say,
Are diverse or variable?
diverse. Yes, diverse. Some patients have get a breath, breathless, difficult breath.
Yeah, breathless, or they have a difficulty to breathe.
Right.
It's okay.
Difficult to breathe. Difficult to breathe. They have a cough.
Cough, like cough, right?
Yes.
Okay.
Yes, cough, cough, and mm, a fever, or fiebre,
Fever.
fever,
Fever.
fever, 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 and yes, and a few patients
Mhm.
uh, has any symptom. There are asymptomatic patients.
Yeah.
Yes.
Okay.
Mm, um, when a patient with COVID has a pathology, a chronic pathology, how diabetes or high blood pressure, it's a big problem because they um, they they have they has a lot complications. Mm,
Okay. That's so good, Vania. That was good. Now I will put you in a situation, okay?
Okay.
Imagine you have diagnosed a stress fracture of the tibia in a young dancer, in a young female dancer, okay? How would you explain to her the cause and the management of this condition?
Okay. You have acute lesion in your bone, and it's probability that your bone is break, and um, we need some studies or some complementary studies.
Complementary tests or studies, it's okay.
Complementary tests, how RX, radiography, and laboratories of your blood. Your blood. Yes. And we need immobilization your leg.
Immobilize
Immobilize.
or unmobilize.
Immobilize your leg. How do you say, para evitar, to evite more lesions or more damage?
Yeah,
maybe.
To avoid could be
Boy.
to avoid
Ah,
more lesions, or what you were saying, to avoid.
yes. Okay, miss. Yes. And we give you some analgesic uh, by you pine or for you pine para el dolor.
For your pain, for the pain.
For your pain. Yes. And if your lesion is severity,
Severe in this case. If your lesion is severe,
you you need a you need appointment with the traumatologist.
okay, that's so good. Or you need an interconsultant.
Yes.
It could be. It's okay.
Yes, and the traumatology, and in this case, you need I stay
To rest.
in outbound. How you say into the hospital. No
You
recuerdo
have
cómo,
to
cómo se
stay.
menciona.
You have to stay here into the hospital or at hospital. You have to rest. Try to explain your patient. Don't worry.
Okay.
And
Okay.
it's, I'm sorry, it's interconsultation. Okay, you need an interconsultation with the traumatologist. Okay.
Okay. Why you should rest your leg and applicate some ice in the place of the lesion.
Apply.
The lesion.
Apply some ice on the lesion.
Okay. Apply some. Yes. only this. We need. We are expecting. The results of the laboratories and
the results.
Radiography. The results. Yes.
Okay, Vania, that's so good. That's so good. You explained to me very good. You just need to practice little words, okay? But that's so good. You make yourself understand. And the last question, maybe, but for high blood pressure, how would you explain the management of this condition to the patient?
Okay. You have high blood pressure, and you need three important support for the treatment. One is diet. You and drink water with our recommendation. The second is the activity, the physical activity. You need walk about or around 30 minutes every day for 5 days continuous. Yes. And the third is the medication, the tablets, the pills. You know, you should get the pill in a time, in exact time. Yes. If you es como, how do you say, seguir el tratamiento? If you
You have to
seguir.
follow the treatment.
If you follow the treatment in the 3 points, you you are no, you will better.
You will be better.
You feel better.
Or if you follow my 3 advices, you will get better.
Yeah, we'll get
You
better.
can say that way. What happened with green vegetables? This patient can
yes.
eat or not?
Yes. You need eat some a lot vegetables, especially apples. Apples are very healthy.
Apples.
Apples
In,
and fresh vegetables.
okay, the green ones. It's okay to eat the green vegetables.
If you don't have erythrocytosis, this is recommended. But if you have erythrocytosis, don't.
Okay, that was a question I had in my mind. Okay, Vania, that's so good. It's perfectly understood then. I will share with my questionnaire, please. If you can fill it for me.
Okay, miss.
And we can, or we cannot speak more. Okay.
Oh, my camera is inoperated in this cell phone because I don't know what is the problem.
Don't worry
But
for these times.
tomorrow, miss, my camera will activate.
Okay, that's good. Don't worry. Take care, Vania. Have a nice night in this case, okay? And see you tomorrow.
Okay, miss. Thank you a lot.
Thank you.
Bye.
Bye. Hi, Lily. How are you? Good afternoon. Or you're muted.
Excuse me.
No, don't
Excuse
worry.
me, teacher.
How are you?
Teacher.
Good afternoon, Lily.
Pretty good.
How is everything? Are you working now or you are on a break?
I worked all day. I returned my house 1 hour ago.
Okay. So your shift was from 8 a.m. to...
And my shift starts from 7 to 5 p.m.
Okay, that's so good. Okay, Lily, so do you remember the topics or the subjects we were talking about last week, right?
Yes, teacher.
Perfect. Do you have any questions about it, first of all?
No, I don't know.
Okay, not for now. Maybe questions will emerge, right? Okay, I will ask you something and I will in some situations, okay? For example, can you list the causes of anemia And another illness or disease you usually manage in your consultation?
Mm, yes, in my consultations, I attend several cases for anemia and other pathologies.
Okay. And what are the causes for anemia? What are the causes?
The first causes are iron deficit, the principal, besides deficit B12, deficit folatos, no sé cómo se llama, folatos.
Iron?
No,
Folatos.
iron, folatos.
Okay.
So
Folates.
folates.
Yeah.
Anemia for loss of blood.
Loss of blood. Okay.
Loss of blood. Anemia for familiar injuries.
Yeah.
Anemia for alteration in la membrana, no sé, for erythrocyte, la membrana del eritrocito.
Okay. Membrane. Alteration in the erythrocyte membrane.
Alteration in the erythrocyte membrane.
Yeah, that's good. Okay.
¿Qué más? No sé. Hemolytic anemia.
Anemia.
Anemia for deficit enzimático, enzimas, no sé cómo se dice. I don't know how to say it.
Deficit of enzymes?
Enzymes.
Okay, what else? Or enzymes in this case, right?
Enzymes. Deficit enzymes. Otro tipo de anemia.
Okay, but those are the most common, right?
Right.
I want to know about another disease you usually manage on your consultation. Could be diabetes, hypertension, I don't know, maybe hyperthyroidism, or I don't know. Choose one, whatever you want, and try to tell me the causes of that disease.
I attend delivers.
Yeah.
I attend delivers. I attend delivers the mild risk or the low risk. The low risk when the patients don't have pathologies associated. ¿Qué más? I attend a traffic accident.
Okay. And well, okay, maybe accidents, right? What are the causes for those accidents?
I attend open fractures, for example. Open fractures, then I have immobilized the limbs, the limbs,
The limbs. Okay,
the
upper
limbs.
limbs or lower limb, whichever.
Hmm.
Any limbs.
Any limbs.
Okay.
Any limbs.
Okay, that's so good, Lily. I will put you in a situation then. Okay, imagine you have diagnosed a stress fracture of the tibia in a young female dancer. Okay, how would you explain to her the cause and management of this condition?
This is a pathology. This is a
This is a condition.
pathology. This is a condition. Pathology fractured. Es una fractura patológica because the dancing.
The dancer.
The dancer for repeat moved suffered trauma. Then I produced the fractured. The managed. No, el manejo.
The management.
The management. The management, I think, have immobilized the limb.
Okay.
Discúlpame.
Don't worry. Don't worry. Okay, you will immobilize the limb, right? And what else?
Skin, ¿cómo es que era el de yeso? Se me olvidó.
I already forgot. I had it in my mind.
O el yeso también.
No,
Tú nos dijiste, I don't understand. Bueno.
Cast.
Cast?
Oh, I have a problem with the connection, but it's unstable. I couldn't listen to you the last part. Okay, the cast.
Cast? Yeso?
Yeah.
Did
you have your? Okay.
You teach me other names. I remember.
Did you write it down? Or did you wrote it in your book or in your notebook?
Yes, pero es que en este momento no lo encuentro. No, es estrabismo, se me olvidó. No, para la próxima clase ya lo tengo listo.
Okay. Okay, perfect.
Okay.
But it's
cast.
Maybe it would be a synonym or a complement, but by now it's cast. Okay.
Okay, teacher.
Okay. So what else? You will say to your patient to stay at home or to stay at the hospital or take this medication, and what else?
All right. I said him that I don't move for period of time. For treat the stabilize the fractured. Besides, I recommended anti-inflammatorios. Drug
Recommend.
Recommend drug anti-inflammatories.
Okay.
And start physical therapy. And start physical therapy.
Okay, that's so good, Lily. Perfect. Plaster cast. It was the correct words. Plaster cast.
Plaster
Okay.
cast. Okay.
Cast.
Okay, teacher.
Yeah, that's what we were talking about last week. Okay, Lily, I will ask you to fill this questionnaire for me, please.
Yes, teacher. Teacher.
Hi, Lily. Okay.
No, the connection is instability.
Yeah, that's right. Okay, Lily, see you tomorrow then.
Thanks,
At
teacher.
6 and 5, I think it's your schedule, right?
6 and 5 for me it's 5 from 5 to 6. It's correct, teacher. Bye bye. The connection failed.
Ahora ya no son los muertos, ahora ya están los vacunados. Después ya la vacuna. Ahí va a tener que cambiar. Vamos, que me ayudan a lavar. Me voy al río a lavar.
Hola, jefe. Quedé en un turno. Yo le dije, jefe, que si yo podía hacer un turno que... Por eso, pero yo me confundí el turno de 19, pero el turno es que le deben un turno a Lorena, ¿no es cierto? Pero entonces yo me confundí, no era el 19, anoté mal, entonces era hoy, esta noche. Pero, por eso, pero entonces esta niña, Ángela, de Tumaco, pues como que ella debía saber, ¿no? Porque ella se comprometió con Lorena a devolverle el turno. Uh-huh. Y usted no me confirmó a mí. Ah, entonces pues yo voy, pero como usted no me confirmó nada, entonces yo que me iba a quedar ahí. Pero no, ese 19 fue porque yo después verifiqué en esa lista que ella me dejó y no, el 19 me tocaba a mí hacerle porque me tocaba, pero entonces hoy... Claro, no, no, no. No, 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 no. Claro. Bueno, y como usted no me dijo, entonces yo dije, no, seguro no quieren que yo lo haga. Bueno, entonces ya voy ahora. Claro. Yo me confundí al escribir eso, entonces era el 23, pero el todo es que era un día. Ella aquí me mandó, después le pedí a Lorena que me que me confirmara cómo es y me dijo el 23 que era, que la jefe le quedó. Bueno, ya, dejemos ahí, ya voy. Bueno, chao. Ay, al t-shirt.